You know that nagging canker sore that just won't go away? Or that heartburn that feels like it's a permanent resident? We tend to just brush these things off, right? But what if they're actually more than just a little annoyance? They're signals from our body, and in this explainer, we're going to dig into how to actually listen to them, from the minor warnings all the way to the major red flags.
So first up, we're going to talk about why your mouth and esophagus are so important. They're your body's first line of defense. Then we'll get into those canker sores and something called stomatitis. After that, we'll tackle GERD, which is way more than just simple heartburn. Then we'll cover the really serious red flags you can't ignore, and we'll wrap it all up with a simple plan to help you take control.
Right? I think we've all been there. And look, these aren't just little inconveniences, they are literally your body's early warning system. So understanding what they actually mean, that's the first step toward taking better care of yourself. Let's start at the very beginning.
All right, let's dive right into our first section, your body's first defense. Before we can really get into the specific problems, we gotta understand why the health of your mouth and throat is just so critical for your entire body.
You know, it's so easy to just think of it as a tube for food, right? But it is so much more than that. This is where everything starts: digestion, getting your nutrition, even your ability to speak. So when something goes wrong here, it doesn't just hurt, it can affect everything, from the nutrients you're able to absorb to even how you feel about yourself. And what's interesting is how all these risk factors are kind of connected. I mean, the obvious lifestyle choices like smoking or a diet packed with sugar, those are major players. But so are things you might not expect, like systemic diseases such as diabetes. Even something like not having good access to dental care can turn what was a small, totally fixable problem into a much, much bigger one.
Okay, let's move on to section 2. We're going to zoom in on something I'm sure pretty much everyone has dealt with: stomatitis, which is really just the fancy name for the dreaded canker sore.
Yeah, stomatitis sounds kind of scary, but it's really just the clinical term for any inflammation in your mouth, and it usually shows up as those super painful canker sores. What they really are is a sign that the protective lining in your mouth is breaking down, and that can potentially open the door to bleeding and even infection.
So, why do these things even show up in the first place? Well, it could be a bunch of different things. It might be an allergic reaction to foods like citrus fruits or cheese. It could be that you're low on key vitamins, like B vitamins or iron. Even just plain old stress can bring them on. And of course, irritants like tobacco and alcohol are huge culprits. Figuring out your personal triggers is really the key to prevention.
Okay, so when you have one, what can you actually do to get some relief? The name of the game is reducing irritation. First, be gentle. Use a toothbrush with soft bristles so you don't make it worse. Rinsing with some warm salt water is a classic for a reason. It helps clean the area and brings down the inflammation. And obviously, stick to soft, bland foods and cool drinks to soothe the pain while it's healing.
All right, we've covered the mouth. So now let's kind of travel a little further down into the esophagus. We're going to tackle another huge one: heartburn, and its much more serious chronic cousin.
Now, this is a really important distinction to make. A little bit of reflux now and then, that's called GERD. It happens to lots of us. But GERD, that's when that backward flow of stomach acid is happening all the time. It's chronic. And that constant exposure to acid is what causes some real damage over time.
So what's actually going on here, mechanically? Well, at the bottom of your esophagus, you've got this little muscle, the lower esophageal sphincter, or LES. The easiest way to think of it is as a one-way valve. Its job is to let food into your stomach and then clamp shut to keep all that stomach acid out. With GERD, that valve gets weak or it relaxes when it's not supposed to.
And you know, a whole bunch of things can mess with this valve and make it weaker. Caffeinated drinks like coffee and tea are big ones, and so is alcohol. Certain foods are famous for it too, like chocolate, citrus, tomatoes. Habits play a huge role. Smoking is a major one, and so is eating really big meals, because that puts a ton of physical pressure on the valve. Even some medications can do it. The first step is really just recognizing which of these might be your personal triggers.
So, what's the game plan for taming that burn? The good news is there are some really practical lifestyle changes you can make. Eating smaller meals more often reduces that pressure in your stomach. Not eating for at least 3 hours before you go to bed, that gives your stomach time to empty out. Propping up the head of your bed is a game changer. You're literally using gravity to help you out. These simple tweaks can make an absolutely massive difference.
Okay, we need to shift gears a little bit here and get more serious. Because while things like canker sores and heartburn are often manageable, sometimes they can be warning signs for something much more serious. This next section is all about the red flags you absolutely cannot afford to ignore. All right, this is super important. We need to know the difference between two types of these lesions. You've got leukoplakia, those are the thickened, white patches that you can't just scrape off. And then you have erythroplakia, those are red and kind of velvety looking. Now, here is the critical takeaway. While the white ones are more common, it's the red ones that are considered way more likely to be precancerous. They need immediate medical attention.
Remember when we were talking about the damage from chronic GERD? Well, this is where that can lead. Over time, your body tries to protect the esophagus from all that acid, so it starts to replace the normal lining with a different type of tissue, one that's more like the lining of your stomach. This new, changed lining is what's called Barrett's esophagus.
And this is the really dangerous trade-off the body makes. Sure, it creates this new tissue that's tougher against acid, but that same new tissue is also premalignant. It carries a significantly higher risk of developing into esophageal cancer. And that is the #1 reason why getting chronic heartburn under control is so incredibly critical.
Okay, listen up, because these are the absolute red flags. These are the signs that mean you call your doctor. No questions asked, no waiting. Any bleeding from your mouth, any sore that doesn't heal up within 2 weeks, a new lump or a thick spot in your cheek, losing a lot of weight without trying to. And this one is huge, persistent and worsening trouble swallowing. If you experience any of these, don't wait, get it checked out.
Okay, so after all that, which can sound a little scary, what can we actually do about it? How can we be proactive? That's what this final section is all about, putting together a simple but powerful plan to protect your health. So here it is, your 4-step proactive health plan. It's simple, but it is so powerful. It starts with you, just doing a quick self-exam of your mouth once a week. Back that up with regular visits to your dentist for professional screenings. Then, actively manage your diet and stress levels to reduce all that irritation. And finally, the 2 biggest impact items: avoid tobacco completely and limit your alcohol. These 4 habits, they are your absolute best defense.
And this quote, it really just says it all, doesn't it? Taking these small preventative steps now is infinitely easier than having to deal with the pain, the discomfort, and the really serious complications that can come from neglecting this stuff down the road.
So, I'm going to leave you with this one question to really think about. Forget trying to do everything at once. What's one small change, just one thing, you can do today to start protecting your health? Maybe it's finally scheduling that dental appointment. Maybe it's cutting back on soda. Or maybe it's just setting a reminder to start that weekly self-exam. What's the one thing you can start today?